Thank you, Domingo. I think we have time for a few questions, if we have some for the panel. Any questions? Karen has one.
I was just curious, Brenda, when you were talking about policies institutionally that you look at that don't help and then you change them, can you just give us one example?
So we had some visitation policies for groups. Actually, there's a couple different visitation policies. One was for children under a certain age had to cut off visitation time at a certain time. Well, a lot of our mothers are under a certain age, so you can't really cut off visitation for the fathers of those children because they're underage. Yeah, that's one example.
Any other questions? All right, well, with that, Karen, do you want to do a final wrap-up and remarks?
I just want to really thank this panel and thank all of our speakers today. Can we just give all of them a round of applause? I think we've had a great day. I think it was really fascinating to me how so many of the morning speakers referenced the social determinants of health and how many of the afternoon speakers sort of referenced the sort of health system and structure and policy. And so really you can't think about what Missouri's going to do in terms of health reform and moving forward, implementing this new legislation and all of these complex programs we heard about this morning. They only go so far. Right? And we know that healthcare doesn't start when patients come to see us. It starts back in their homes and it starts back in their communities. So I think, we all feel strongly that we have to look at all of this as a whole if we're really going to reap the benefits and the promises of coverage and access and care for people in our state and in our community. So I'm just thrilled that we were able to put these panels together like this because I think they are so important and they're equally important. So thank you to those of you who stayed. Please fill out the evaluations. We really do, many of you who've been here a number of years really know that we read every one of them and we take your suggestions. And so if you have ideas, every year, for those of you who are new, we do 2 topics, one in the morning and one in the afternoon. The last Friday of October, every year, Missouri Health Policy Summit, even if it's Halloween. So sometimes we come in costumes, but we try to look for health policy issues that we can come together as a state to really think about and really discuss in a forum we may not have an opportunity to do so in just the rush of our everyday lives. So please fill out the evaluation. Please give us your ideas about topics for next year. That's very important and weighs very heavily on how we structure these annual policy summits.